Now, a few important points here. TB is not easily spread, so if you're considered an at-risk contact, the health department will reach out to you. If you've been exposed, keep in mind, it will take weeks to months before you develop symptoms, if you ever develop symptoms. Until COVID-19, tuberculosis was the deadliest infectious disease in the world, killing 1.3 million people in 2022. Now, the most recent data for the U.S. showed it killed 600 people in 2021, and we had over 8,300 cases in 2022, 145 of which were in Ohio, including 27 in Cuyahoga County and 1 in Ashtabula. Now, tuberculosis is a bacterial infection, usually attacks the lungs, but it can also attack the kidneys, spine, and brain. Treatment involves taking different types of antibiotics for 6 months to a year because this is a difficult bacteria to kill.
Pneumonias can actually be very, very difficult to treat only because we're seeing a lot of resistance to antibiotics in other parts of the world, but also because it's such a slow-growing bacteria, and things that grow slow die slow. And so it doesn't respond very quickly to antibiotics. It takes a long time to eradicate an infection, whether it's hibernating or it's active.
Now, while anyone can get tuberculosis, it is more often found in people from other countries. Hispanic, Black, Asian American, Pacific Islander, and indigenous communities. 88% of those cases in 2021 were among racial and ethnic minority groups. Now, the Ashtabula Health Department sent the patient's sputum to the Ohio Department of Health 2 days ago. They got the lab results now, and they are, again, the findings they have found have been released on their website, and they are shared with the community. And anybody who has been a close contact is going to be contacted in this point. And again, you know, most cases that they find are actually usually come back negative. So this is kind of an anomaly. But again, this is not easy to spread. This is long-term close contact. So that's the good news part of it. And a lot of people who get this, it lies dormant, and they never even know they have it for years. Yeah.
Wow. And I'm sure there are a lot of people wondering, wait a minute, isn't there a vaccine for tuberculosis?
Yeah, I had so many people ask me that today. Yes and no. So there is a vaccine, and very fortunately, we don't need it here because we have so few cases. It's more often given to infants and small children in countries where tuberculosis is prevalent.
Okay.
So you mentioned before the symptoms, weeks to months to come up. What are some of those symptoms?
So typically it's a cough that's going to last more than 3 weeks, chest pain, night sweats, weight loss, fever, chills, weakness, and often, like say, people may have latent tuberculosis, which has no symptoms, and they may not even know that they have it. And those are the people who are not infectious. That's very important to understand. It's the people who have active disease who are coughing, and those respiratory droplets are what other people inhale, and that's what's infectious. But if somebody has latent tuberculosis, they are not infectious.
That is so good to know.
Yes.
Oh, Monica, thank you so much.
Sure.
Really good information tonight.